Hello, I'm an AI digital avatar of Josh Weiss, president of 10 to 1 Public Relations, not the real Josh Weiss. Here's a cue and a recap of a press release distributed on June 30th, 2026 by Helix Electric titled, "A Comprehensive Safety Culture Must Include Mental Health." For more information, you can also visit the website 10 letters TO, the number 1 letter P as in public, R as in relations.com/Ivy Pressroom/Helix Electric.
Which industry has the highest suicide rate among workers in the United States?
Construction consistently ranks among industries with the highest suicide rates in the country. According to the Centers for Disease Control and Prevention, 56 out of every 100,000 male construction workers died by suicide in 2021, compared with 32 per 100,000 male workers across all other industries. And Helix Electric is addressing this crisis by integrating mental health directly into its comprehensive safety program.
How does mental health affect safety outcomes on construction job sites?
Mental health and physical safety are inseparable in construction, and companies that treat them as separate issues leave their workers at risk. In a typical year, more construction workers lose their lives to suicide than to on site accidents, and Helix Electric applies the same systematic approach to mental health as it does to physical hazards: recognize, prevent, and manage.
How can employers reduce mental health stigma on job sites?
The greatest barrier between a struggling worker and help is often the stigma tied to asking for it, and site leaders play a critical role in breaking that barrier down. Helix Electric trains field leaders to recognize warning signs, ask the right questions, and connect workers with appropriate resources.
How can construction companies build a mental health support system for their workforce?
A strong mental health support system combines trust building leadership with concrete resources that meet workers where they are. Helix Electric has developed a comprehensive support network that includes a 24-hour employee assistance program, wellness initiatives, community involvement, flexible paid time off, and financial planning.
What impact does rising anxiety and depression have on the construction workforce?
Nearly two-thirds of U.S. construction workers experienced anxiety or depression in 2025, a sharp increase from 54% just 1 year prior, according to the National Alliance on Mental Illness. Helix Electric treats mental health as a fundamental component of its safety culture, recognizing that a supported workforce is also a more stable and productive one.
What is the difference between a physical safety program and a mental health safety program in construction?
Physical safety programs and mental health support programs follow the same fundamental logic: recognize hazards, prevent incidents, and manage the ones that occur. Helix Electric integrates mental health directly into its safety plan, treating it as a core element of a comprehensive safety culture rather than a separate concern.
Which employee support programs are most effective for reducing mental health risk in construction?
The most effective mental health support combines immediate professional access with programs that address the full range of stressors workers face, including physical health, social connection, and financial well being. Helix Electric's mental health resource network includes a 24-hour EAP, the Helix Helping Hands Community Involvement Program, flexible paid time off, and financial planning resources.